So we'll pick up where we left off this morning, looking at the cranial nerves from the same anatomic approach. Now here what we're looking at is the schematic drawing of the undersurface of the brainstem. So this morning we looked at the so-called upper cranial nerves. There's the first olfactory tract cranial nerve and the optic nerve. You see here the chiasm and the optic nerves, optic tracts behind that. Remember, those two are extensions of the central nervous system. Then we reviewed the third and fourth and sixth cranial nerves. Remember, the fourth wrapped around the brainstem because it's the only cranial nerve that exits the dorsal brainstem and it crosses the midline before wrapping around the brainstem and joining the third cranial nerve between the proximal posterior cerebral and superior cerebellar arteries en route to the cavernous sinus. Sixth cranial nerve here at the pontomedullary junction, ascending in the prepontine cistern. Now we'll look at the seventh and eighth cranial nerves, which both exit the brainstem at the midlateral pons and slightly anterior and enter the internal auditory canal. And we'll consider the nerves that traverse the skull base via the jugular foramen. That is going to be the glossopharyngeal nerve, ninth cranial nerve, the vagus nerve, the 10th nerve, and then the accessory nerve, which is formed by a number of rootlets in the first 5 cervical segments. They actually ascend, getting access to the skull base via the foramen magnum, and then coalescing into that 11th nerve will join 9 and 10 into the jugular foramen. And finally, the 12th cranial nerve, the hypoglossal nerve, has its own foramen, the hypoglossal canal, and that's going to be formed by rootlets coalescing from the pre-olivary sulcus to form the 12th cranial nerve. So we're going to look at the high-resolution images I mentioned this morning, and in a number of cases, remember this affords us excellent spatial resolution. Contrast resolution when we're looking at CSF versus soft tissue structures, even bright T2 tissues will be disparate in its appearance on the images from CSF. It doesn't lend us the contrast resolution within the parenchyma, however. We need to use the flare and other sequences for that. But look at the beautiful depiction of these nerves. There's the 6th, 7th, and 8th cranial nerves, beautifully depicted on these. We can even see the architecture here of the labyrinth here within the membranous labyrinthine structures. Now, I mentioned that the 7th nerve, when we reviewed the 6th nerve nucleus here in the dorsal pons, the fascicles wrap around the nucleus of the 6th cranial nerve, forming this facial colliculus. The bumps here where the internal genu of the 7th cranial nerve resides. So any lesion that affects that can affect the 6th cranial nerve because of the nucleus, the abducens nucleus, and the fascicles of the 7th cranial nerve. So a patient could end up with a diplopia and a ipsilateral facial nerve palsy. Small plaque, significant